Hey everyone, welcome to another episode of What the Dementia by Bambu Care. I'm your host, Brianna Wilson. I'm a certified dementia practitioner and the founder of Bambu Care, where you can find us at letsbamboo.com. In today's episode, we're going to talk about 5 hospice myths. If you didn't already know, for the month of April, we are going to be talking about all things end of life, including hospice care, and actually quite a bit of hospice care. So on our blog, on the podcast, on YouTube, in the treehouse, everywhere. End of life is the focus for the month of April. Now, inside the treehouse under the Paw Pass, we actually just released a podcast episode about providing good care while letting go and what that actually means and looks like. Super important topic, okay? So if you aren't already a member of the treehouse, you should definitely join us. The treehouse is the ultimate dementia resource library for dementia caregivers. It has everything all in one place, from podcasts, videos, blogs, and webinars to product recommendations, activities, resources, and printables. You can join our support community from there as well. So literally the whole 9. So come check it out by visiting letsbamboo.com/treehouse and grabbing a pass, okay? So let's go ahead and get into these 5 myths about hospice. So the first myth is that hospice hastens death. Now, this one is super controversial, and we will talk a little bit about why in just a minute, but it's important to understand that hospice philosophy accepts dying as a natural part of life, and it neither strives to prolong life nor hasten death. Instead, it's about managing distressing symptoms as a person's terminal illness runs its course. With that being said, not all hospices are created equal, and there are going to be some bad apples, which is why it is so important to do your due diligence in researching and learning about the different hospice providers available in your area. And to help with this, we actually have a hospice questionnaire available for you inside the treehouse. It outlines the top 20 questions to ask when you are deciding which hospice provider best meets the needs of your partner. All you need is a house pass to access it, and you'll find it under resources. Just search hospice, and you'll also see the hospice eligibility criteria that we talked about on a previous podcast episode as well. Now, something that I want you to realize with this idea of hospice hastening death is that if hospice inherently hastened death, meaning it was just built into the model of care by default, we wouldn't see such a high rate of live discharges and long stays for individuals with dementia. And then, generally speaking, most people with terminal illnesses actually live longer on hospice than those who do not receive such services, okay? So, why do people believe hospice hastens death? Well, now it's a little bit more complex because there is, I think, like 10 states plus Washington, D.C., don't quote me on that have legalized medical aid in dying, also known as physician assisted death or death with dignity. And so, in these areas, medical aid in dying is one option in the palliative care continuum for those who meet eligibility criteria. But this is for people who are requesting for this, okay? The decision isn't just being made by the physician or hospice team, okay? That's important to understand. Now, we know that Oregon was the first state to legalize this, and then since about 2009, I believe, there have been an increasing number of states that have jumped on board. But even before this, people still believed hospice hastened death. So let's talk about that. So there's 2 parts in my opinion. So one is that many people don't like the fact that hospice will recommend the discontinuation of certain medications. And many people believe that stopping some of these medications will lead to an untimely death. But typically, hospice isn't just making these recommendations all willy-nilly. It's based on things like wanting to lower the risk of drug interactions, wanting to reduce pill burden, especially if the person is having a hard time swallowing, and wanting to relieve certain medication side effects that overshadow the benefits of the medication. Again, at this stage, it's all about comfort and quality of life. But this is also why it's important to ask questions so that you understand why these recommendations are being made, because deprescribing is really a whole process, okay? The second part of why people believe hospice hastens death is because of this. The reality is, hospice uses powerful and potent medications to help manage distressing symptoms. And so, among those that bring up the biggest concern for people are Haldol, Ativan, and morphine, and people like to call this the ham sandwich, apparently. Haldol H, Ativan A, morphine M, because for some patients, they can be used in combination. So, Haldol is typically prescribed for delirium, agitation, and restlessness, and generally speaking, should not be used to treat behavior problems in people who have dementia, even at the end of life. It should really just be a last resort, okay? Ativan is typically prescribed for anxiety, and then morphine is typically prescribed for pain management and shortness of breath. So, depending on the person's symptoms, different medications will be recommended and administered. Now, because these are potent drugs, they do have to be carefully administered, monitored, and adjusted, which is what a good hospice will do. However, it is possible to abuse this, right? It is possible for there to be administration errors. It is possible to have a not so good nurse. So, yes, if these medications are not appropriately dosed and administered, they can result in things like respiratory depression, coma, or even death. But this is not the intention of hospice. There is no goal to overdose patients, okay? But realistically, it can happen. And also, let me just throw this in here real quick. It actually doesn't even benefit hospices in most cases to prematurely kill their patients, because Medicare and other insurances reimburse hospices on a per day rate. So it actually benefits hospices to keep people on hospice for as long as they can without getting audited. And we do see this as well. But there's really no incentive to kill patients at all, and especially not kill patients prematurely, okay? The second myth is that hospice means everyone has given up. And this myth is probably one of the most damaging to caregivers' mental health or family in general, because they feel like enrolling their partner into hospice means that they've accepted defeat, okay? And so they have a really hard time making this transition because they feel like there may be something else that can be done to improve their partner's condition, to make them eat more again, to help them regain their strength, etc. And in some cases, this can be true. I'm not going to lie to you. The reality is, the end of life trajectory for people with dementia is hard to prognosticate, and all physicians aren't aware of all the things that they should be considering. So, some people with dementia are prematurely put on hospice. In other cases, the person actually may qualify for hospice because of a temporary setback or decline in health, but then actually improve with hospice care. And the most common scenario that I've seen is that a person with dementia is admitted to the hospital for something like an infection. And maybe while they are in the hospital, their condition is worsening. Maybe they aren't even getting the best care in the hospital, for being honest, and things start looking real bleak. So someone comes in to discuss hospice, and a determination is made that, oh yeah, they qualify, which under their current condition may actually be true. But then once they get out of the hospital, get proper attention and care, their infection gets under control, they start eating and drinking again, their condition improves, and they return back to their baseline or near their baseline. And hospice, seeing that their condition improves, determines that, oh, look, they're doing great. They're actually no longer projected to die within 6 months. And so then hospice discharges them. And they call this graduating from hospice, which is kind of weird terminology in my opinion, but yeah, so this can happen. So, because this can happen, caregivers may feel the need to fight to see if they can help improve their partner's condition. And this can even look like not enrolling in hospice care to begin with. But it's important to understand that hospice care has nothing to do with giving up. It's about prioritizing comfort and quality of life when the inevitable is approaching, okay? So, the whole point of hospice is to manage distressing symptoms that may arise as a part of the person's terminal illness and from the dying process itself, okay? Now, a person doesn't have to utilize hospice services if they don't want to, and we'll actually be talking about this more inside the treehouse. But it's important to understand that what hospice creates is a support network for both the person directly on hospice services and their family. So, equipment and supplies, medical monitoring, a 24/7 helpline, extra help through hospice aides and volunteers, a little respite, after death coordination, bereavement services, things like this, which can be really important during this transition period and at the end of life. But it's really about what the family and patient want as they navigate terminal illness, okay? Not everyone cares about quality of life over quantity of life. And even if they do, not everyone views quality of life the same, okay? But really, I want you to think about hospice more as an optional service that provides one way of helping you prepare and support your partner through the inevitable, okay? Now, the third myth is that hospice is a permanent decision, and this couldn't be furthest from the truth. So, you can actually disenroll from hospice at any time for any reason. So, just because you elect the hospice benefit doesn't mean there's no turning back. You can always revoke enrollment. You can also change hospice providers for any reason as well. But the catch is you can only change the hospice provider once during each benefit period. So the initial hospice benefit period is two 90-day benefit periods. So that's two 3-month periods. And within each of those periods, you can change hospice providers once. Does that make sense? But this is why it is so important to do your due diligence in researching the hospice provider beforehand, okay? But the point is, hospice is not a permanent decision. For example, you can literally enroll in hospice one day and change your mind the next and disenroll. Obviously, they would prefer you not do that, as it is a lot of work to get everything coordinated, but it is a right you do have, okay? The fourth myth is that hospice is only needed in the last few days of life. And this is actually the number one mistake I see caregivers or family members make, and that is waiting until they see active signs of dying, like no longer eating, having difficulty breathing, falling unconscious, things like this. This is really too late to reap the full benefits of hospice. I mean, it can still be worth initiating at this point. That's not what I'm trying to say. But you really want to take advantage of hospice earlier on when the person first becomes eligible. So if you haven't listened to podcast episode 126 on hospice readiness and dementia, eligibility and signs, or downloaded the hospice eligibility criteria printable from the treehouse, please do. And then the fifth and final myth that we're going to talk about is that hospice must not be needed yet if the doctor hasn't mentioned it. Now, unfortunately, physicians are not great at bringing this conversation up, especially for people with dementia, because again, prognosis can be hard to predict and it can just be a hard conversation to have and bring up, especially because people are kind of resistant to the idea of hospice care. So, this is why it is so important that you empower yourself with knowledge of the criteria so that you can reach out to the doctor or hospice provider to initiate or inquire about services on your own. please do not wait for or rely on the doctor. Many doctors mean well, but they don't always do well. Okay? But that is all for today's episode. I hope that you found this podcast episode helpful. If you did, please consider leaving us a review to help others find the podcast. It would really help us out. If you have any questions, comments, or future podcast requests, you can always send us an email at podcast@whatthedementia.com or contact us through letsbamboo.com. Thank you so much for joining us on another episode of What the Dementia by Bambu Care. We look forward to catching you on the next episode. Take care, and until next time, stay strong, care on, and remember, you are not alone. Bambu Care is always here.